This is the Nichole Joy Show. Welcome to my corner of the internet, where motherhood, business, and spirituality collide. I'm your host, Nichole Joy, mother of three, corporate dropout turned energy healer, podcaster, mentor, and author of Walking Mom Home. If you've been listening for some time and are curious but not quite sure how energy healing will fit into your life or into your business, try me. There's a link in the show notes where you can apply to work with me, and let's chat. Thank you. And you too. Thanks for making the time because I've been podcasting since 2019 and I took a pause like a year and a half ago. And this fall, I've been feeling the desire to get back on the podcast. And a lot of what I want to talk about and where I'm taking the show is my personal journey. I share a lot of my personal journey, and my community tends to be a lot of moms, a lot of holistic with a side of conventional tends to be my crowd, mostly because my background in the birth world. So I have a lot of moms in my community. And so I share a lot about my own experiences and how I navigate all the different health things that I go through, what I do on my side of the fence, which I know we talked about a little bit. And last week, so part one of the episode, I shared my journey, my personal journey. And then I thought, you know what, it would be really nice if you came and shared the professional side, the medical side, the side that's not my area of expertise. Because I feel like every time I am brave enough to talk about dental stuff on my social media, people reply in private. People want to talk privately. It's just, there's so much stigma and it's such a sensitive topic, teeth, for so many people. And I'm kind of over the stigma. So I'm going to just jump in. This is my doctor, everybody. This is, well, one of you, and I have a team. So I have you and another doctor who was doing the other parts. You're based in St. Pete. And you have had the steady hands behind my year-plus long experience with this dental healing journey that I had a lot of anxiety about. I did not have great dental experiences as a child. So one of the things I shared in part one was that when I entered your office, your whole staff, I felt from the minute they took my phone call until I went into the back rooms, my body felt very relaxed and calm with everybody. And
Wonderful. That's fantastic to hear. I mean, we work very hard to have that kind of vibe, and I'm very happy to hear that you had that kind of experience, Nichole.
It shows. It shows. And, when you mentioned that you had something like 20 plus years in this specific part of dentistry,
Yeah.
it got my attention. And I didn't have a poor experience with anybody in the office, from front desk staff, which is rare, I think. I've been to a lot of dentists, so I've had a lot of issues throughout the years, as an adult, I should say. And so if anybody missed part one is on the show. You can go back and listen, but high level summary, we removed 2 old root canal stuff. So we got the dead teeth out, cleared the infections from the old root canals, rebuilt the bone with grafting and a sinus lift, and then ultimately placed 1 ceramic implant. So having said that, I am curious about what made you on your journey get into this specific area of dentistry where you focus on periodontics and implant surgery.
Yeah, when I went through 4 years of dental school training, the surgical side of dentistry really caught my attention. I really enjoyed the surgical side. So that led me to either oral surgery or periodontics. And when I was looking at both specialties, I chose on the periodontics just because the time frame was shorter on the perio side, 3 years versus 6 years of residency. And so I chose that from day to day dentistry. I think suits me better because the oral surgery side, the training is double the time, but they're more training for trauma, hospital associated oral surgery, head and neck injuries, or head and neck cancer type of treatments was what oral surgery training was mostly about. So I went to the periodontic side, which was more related to the dental side of the surgery. And when I came down to Florida, I met someone in Clearwater that was a holistic general dentist. And he begged me to look into really zirconia implants. And at that time, I didn't even know that zirconia implants existed. This is 2005.
Mm.
So at that time, this is 20 years ago, right? So at that time, we were never even taught that zirconia implants existed. I thought this guy was kind of out of his mind because, he was just talking nonsense to me. I didn't even know that kind of thing existed. He was so fascinating, though. So on a Saturday, I decided to go meet him at the office, and he was doing things in his office that was not conventional dentistry. And I thought that was so fascinating, such as muscle testing. He was sending these root canal teeth to laboratories to have it examined to see what kind of bacteria was found on along these teeth. I mean, we just didn't do that kind of thing. We would just extract the tooth and just kind of dispose of it. We wouldn't like study what kind of bacteria that was in there. Muscle testing was another thing that I thought was very fascinating. After spending a whole day, I saw that he had a practice that was kind of like Chinese medicine. He included herbal regimen into treatment. And, after spending that whole day, I really found it fascinating. So that led me to exploring the biologic side, the functional medicine side, the holistic side of dentistry and surgery. So 20 years later, I have this practice, a very unique practice. I am a periodontist by training. I'm a board certified periodontist. However, I have incorporated a lot of the techniques and materials and sources that are available to us, not in the traditional side of dentistry and periodontics, such as, the ceramic implants, but it is getting very popular these days. In the last, I would say, 5 years, it has really exploded. I have now patients coming in, at least one or two patients that are coming in for new patient consult that are inquiring about non-metal implants. So I
Yeah.
kind of deviated from your question of how I got into this, but I'm just continuing to talk about this.
It's perfect.
Yeah.
Perfect, because I was actually gonna move into what brought you a little bit more on the holistic side. It's interesting to hear the journey, and it's interesting that 20 years ago, there was a holistic dentist in Clearwater, because even now, when I started the search, I had only just begun to hear about holistic dentistry, and I've been in the
Mhm.
holistic space for, I don't know, I started coming into this space in 2017-ish when I
Mhm.
was living in Chicago, because it
Mhm.
tended to be a lot more popular there.
Yeah.
That's more physiological birth centered, and it introduced me to the holistic space. So when I came back to Florida, it was a bit of a wake up call here, but
Mhm.
that's interesting that 20 years ago there was somebody. I can appreciate Chinese medicine, and I will say, when I was in your office and I remember asking, "Hey, is it okay? Do you have a problem with me doing my energy healing on the materials?" And
Yeah.
you didn't get that deer in the
Yeah.
headlights look, which I have from other
Right.
providers. And they
Right.
looked at me like I was crazy. And I thought, I can't let them operate on me if they think I'm crazy, you know?
Yeah.
And so I really appreciated that.
Mhm.
And I guess I'm going to shift into a bit of the mom lens
Mhm.
and this particular age that my group tends to be in, where I don't want to say the word because I don't want to associate. Let's just say where there's a lot of hormone fluctuations in this
Yes.
age
Yeah.
and this age,
Mhm.
this season.
Mhm.
And so as a 40 something mom of three, who I also have shifted from very conventional. I mean, I didn't know anything about holistic life until about 2017, I'd say.
Mhm.
I continued to wonder over my research in different dentists and periodontists how much of what was showing up in my mouth was common in other women like me. And do you tend to see a pattern of women my age coming in who may have experienced pretty severe nutrient deficiencies throughout creating people and
Mhm.
breastfeeding and that whole journey of being so depleted on nutrients and the teeth suffering?
Mhm. Yeah. It's moms and babies, when they say the term, the babies suck everything out of you, of the moms. I mean, that literally is true, as a mom of three, that your body has gone through so much changes after each birth. And so it is super important. I mean, the OBGYN community, they're very familiar with vitamins during pregnancy, postpartum also, they do that, but it is extremely important to take care of periodontal health. Actually, during my residency, my research was on preterm low birth weight babies and periodontal disease. And this was 24 years ago, where, cardiology, periodontics had some relationship there where patients were dying from heart attacks. They were finding periodontal pathogens or bacteria in their heart valves, and it could not come from anywhere else but from the mouth. So that's when all this research has led to low birth weight babies and preterm labor on moms that have severe periodontal disease. So it is very important as a mom. And unfortunately, it's not a common thing for OBGYN practices to push patients to have a dental exam. It's just a checkoff list. It's you should have go see a dentist on 10 million things that the mom needs to do. But I don't think, focus on the importance of dental exams, and actually a periodontal exam and a dental exam should be the case, because periodontal disease, the bacteria within the gum itself, if you have infection there, that infection could lead to the baby, of course, and leading to preterm low birth weight babies. And now, 23, 24 years later, we know that there's scientific evidence. There's so much research on this topic, and now it has expanded to not just preterm low birth weight babies, to dementia, to Alzheimer's disease, to all sorts of other systemic problems that the dental problems has led to. So it is very important. I think a vitamin world, the vitamins are kind of controversial in that so either you believe in vitamins or you don't believe in vitamins. And some of the physicians will say, you're wasting your money, you're peeing everything out. But I am a strong believer in vitamins and supplements and herbs. And I believe that the earlier you start, the better. I have a 20-year-old son and an 18-year-old daughter right now, and they've been taking vitamins ever since they were, single digits. I mean, when they were even very young. And so I'm a strong believer in supplements. I think moms, for sure, they need more than just a multivitamin. If I can say to you, I have some products that we recommend for patients. So, for example, many of our patients are put on supplements like this. This is, I'm dealing with bone health, right? I'm dealing with jawbone health. So, and I'm dealing with an older population that may have osteopenia or osteoporosis. So it is very important for me to optimize their bone health. A lot of our consultations when patients come, now, Nichole, you're one of the younger ones that I've seen. Okay, I would say mid-age or younger than most of the patients that I see. A lot of the patients that I see are 60 plus, and so many of them are osteopenic or osteoporosis. And so I try to optimize their vitamin D levels. The Metagenics brand is excellent. I recommend that for a lot of patients. And that bone builder is just one of them, along with vitamin D3 and potassium.
I'm taking notes because, and I remember seeing that in your email. So I'm on
Yeah,
your email list. I remember seeing the Metagenics,
yes,
and I plan to talk to you guys about that when I come back for
mhm,
my mouth guard. I have to come back at
yes,
some point for my
yes.
mouth guard. And so I wanted to ask just a few follow-up notes about that. During pregnancy, this is something that's really important. And I can say, even in my last pregnancy, when I was already a doula, I was already a birth doula by that point,
Mhm.
and still I was never told by any of the midwives. I went to a practice that was a combination of midwives and OBGYNs, and none of them ever, I mean, they just said, make sure you get a dental cleaning. And I thought,
Yes,
okay, just get a dental cleaning. And I did not realize just the extent of issues that nobody's having that conversation. At least at that time, nobody was having that conversation. I have a lot of birth workers in my community,
yeah.
Tampa based, this whole Central Florida region based, but also really internationally as well. And I think just as a birth worker, if you're listening, knowing that, um, there's a gap between what the OBGYNs and some of the midwives are sharing and not sharing, and for these women and families that you're taking care of. And so incorporating some of this conversation, perhaps like referring to the episode, referring to your website, finding somebody in their area, whatever the case is. But I think that that's really important. You said gum exam. I don't think I ever had a gum exam. I'm 42 years old. And the
Yeah.
first time you guys saw me, I think I was 41. And I don't think I'd ever had a gum exam in my life.
Yeah.
Mind you, I didn't grow up going to the dentist, right? I went to the dentist once as a kid and I needed a root canal because there was pain. And we just, we didn't have dental insurance. Nobody thought it was important. But I'm also shifting gears a little bit. Actually, it's connected. So another conversation that's big in the birth world is hormonal birth control. And, I know for me, when you mentioned that I was one of your younger patients dealing with the bone loss, I do feel like there's a combination of things that I really didn't have a chance to go into great detail on that first part of the episode, but I was on Depo-Provera for years. And that's another thing that it's a hormonal birth control, the shot. And nobody told me while I was on it that I should be supplementing additional calcium because at one of my final shots visits, I want to say it's every 6 months you get a shot. I can't remember. It's been a long time. The nurse said, are you making sure to take your calcium? And I said, what calcium?
Yeah.
And she said, no,
Right.
when you take Depo-Provera, you need to be taking calcium because it sucks the calcium out of your bones. And I'm like, fantastic. So
Yeah.
that working against me, I have a lifetime of not knowing how to really take care of my teeth other than brushing and flossing, which is not enough. And not knowing the bacteria situation and being a mouth breather and being a grinder and all of these issues that are contributing to major mouth issues. And then just severe depletion throughout my lifetime, just being so depleted, I feel at a cellular level, not just during motherhood, but just overall depletion. And so I would really encourage if you're a mom or if you're a person to really, what you're talking about with supplementing is so important. I'm a supplementer. I'm a huge fan of supplements. I also like herbs. One of my providers is a Chinese medicine practitioner. She's on the West Coast and we work on a lot of things together. So I'm a huge fan of taking herbs. I'm a huge fan of supplements and getting updated blood work regularly to see where things are at. And now I'm a huge fan of checking out the gums because that's another issue that I'll bring up in a minute, that I've got some gum stuff that now I'm beginning to explore. But I will say one thing about supplementation is if there's providers who really feel like, oh, you're just going to pee it out. I think it's important to know, and you probably know this, like not all supplements are created equal. And then the body is not always absorbing them if you're just popping them whenever. I've started to time things in different ways depending on what I'm eating and what I'm taking with it. So something different I do, for example, is, I checked my blood a few months back and I was very low on iron, which makes sense for a lot of other issues I've been having, but taking the vitamin C with the iron to help with absorption. So there's different things that are helpful. And even when you were working on my mouth throughout this whole year, I was taking an herbal bone. It was a liquid. So at the time, I didn't realize you guys offered that line, but that's something I'd like to look into as well. Because I'm going to continue to work on the bone healing. It's not just one and done. The next thing I was thinking is for people who have old root canal sites, which is what I had. I had two that were in the same area, one of which we had identified had a pretty significant infection. But generally speaking, and I know it's hard unless it's your patient, but generally, when would save it be reasonable? And when is the route that I took, extract, possible graft, and implant, the safer route?
Yeah. So the root canal debate or questions that I get, it's very, very controversial. You will find that 98% of the dental community will be fine with getting root canals, or they'll recommend getting root canals. A very small percentage of the holistic community, I would say, will not recommend getting root canals because they feel that leaving a piece of dead body part in your body is not the right way to go. That's one way. Their focus is more like, if you have a nail bed that got damaged, that nail dies and it doesn't stay, intact. It usually falls off or you have it removed, and a new nail grows in. Now, unfortunately, we don't grow new teeth, but that's kind of like where their debate is. As far as root canal treatment is concerned, I think that when someone has root canal treatment, and most of the infection or all of the infection is taken out of that tooth itself from the root canal system, yes, it could last for many years, and that dead piece of tooth could be in your jaw for many years to come. And patients might not even have symptoms. Patients might not even have other issues medically. But in your situation, as you had other, you had obvious signs and had other problems that was associated with it. So, patients that are more sensitive or ultra sensitive, they'll know right away that something's not right. They might have headaches on that side. They might have issues in their shoulder, arm. They can't move along that side. This all leads to the meridian system where things are connected, right? So you can look at the chart where, all of these teeth, one by one, some of these teeth are related to like the breast, for example. There's been some studies that say, what was amazing was when I talked with someone that has been diagnosed with like breast cancer, let's say, and all of these patients that had with breast cancer, they all had certain root canal treatment to two different teeth, actually four different teeth. It's the upper right molars on the upper right side or upper left molars. So those four teeth, if you have root canal treatment, they're saying that the chances of you developing breast cancer is higher. It's because you're blocking the energy or the meridians along your body. That could be the case. I don't know if I completely believe that having a tooth infection will lead to cancer. I'm not saying that, but I'm just stating a study that has said that all of these breast cancer patients actually have had root canal problems on those four particular teeth, which was quite astounding because it was 100%, of these patients that had root canal. So there is a significance to that.
I remember that
Uh,
study too,
yeah, yeah,
because it was referenced in the root cause documentary. And
yes,
I don't know if you saw that. There were
yes, I
people, I
did.
think, who felt like it was a load of crap. And I think a
Hmm.
healthy level of skepticism is fine. I have a little bit of skepticism, but I'm more
Hmm.
of I can believe it before I see it on
Hmm.
that, but I need people, I need a doctor like you who has a different level of skepticism who's doing the
Hmm.
operating, right? I'm not the one
Right.
doing the operating. So I can
Hmm.
be in my zone with it. But I remember hearing that, and I was part of what, because mine were in the top right. And so that's
Yeah.
part of what I was paying attention to, because really, I'll say over the last several years, as a part of getting into the holistic community, but also exploring energy healing and becoming an energy healing practitioner for 6 years now. One of the things I've noticed is as my body's gotten more sensitive, like you were describing, people who are more sensitive to some of the older conventional things, I've taken a more, I guess what some would say, a more proactive approach to some of this,
Hmm.
because I have a lot of reasons, but I've taken a more proactive approach because I just don't want to, like, so I had breast implants removed
Hmm.
4.5 years ago. And I wasn't
Hmm.
having any symptoms. There were people who say like, oh, when you feel like you have the breast implant illness, and I never had any symptoms, but once I learned about the potential issues, I thought, you know what? And there were personal reasons too. And I took them out.
Hmm.
And so the same with these,
Yeah.
and when I saw the connection to breast cancer, I
Yeah.
thought, you know what, I just, it was a noticing, and
Hmm.
things kept coming into my awareness, and I thought, I just want them out. And luckily, they were both on the same side. So when you were able
Hmm.
to, when you
Yes.
operated, it was all in one shot.
Yes.
And
Yeah, so root canal teeth, unfortunately, by the time I see the patients, many of them have already had root canal treatment and they're coming to see me because they're having symptoms still. They're having pain somewhere, either there or somewhere else. And we end up removing the root canal teeth and replacing it with either implants or a bridge option. So, by the time I see patients, they're very much like yourself. They had already root canal treatment. Unfortunately, it didn't work, or they continue to have symptoms. And so are able to help patients like yourself have a second chance because we are able to remove it and replace it with a zirconia implant. So this will now maybe go into zirconia implants versus titanium implants. I was trained with titanium implants. Everybody is trained with titanium implants, and I've come to learn over the last the first 15 years of my career, I learned that, these big companies, multi-million, multi-billion dollar pharmaceutical companies that own these implant companies have, I think, maybe tried to make things cheaper and more profits. So instead of using just pure titanium, it's 99% pure titanium, but there are trace metals in there. And so over the years, patients have developed allergies to some of these trace metals because you're not supposed to have allergies to titanium. However, we started seeing allergies. Patients were allergic to titanium. And so we found out that it's these trace metals that is part of it. So they try to make it harder, they try to make it cheaper. And so that's what patients were reacting to. Another problem with the titanium implants have been corrosion, where you would think that a metal implant or a titanium implant will just stay within the bone. But when they have gone back, and if you look at a titanium implant of the hip or shoulder or anywhere in the body, the orthopedic surgeons will know this. There are metal shavings all over that area. So if they go back in after a shoulder implant surgery and they go back in, they'll see like a metal tattoo all over the soft tissue. And it's because the metal corrodes and the shavings just come off. And where does it go? It goes all over your body. It goes into the muscles. It goes into your blood system. So this is one of major causes. I mean, the titanium implants have been around for, I would say, 50 plus years. Maybe back then it was made with almost more pure titanium, so they didn't see these problems. But it's more so that we're seeing issues within the last 20 years, 25 years, where like the big pharma, I think, has gotten their hands on these big companies. So the zirconia implant system is, I think, a very good option for someone that is highly allergic to certain metals. For someone, you don't have to be allergic, but it's just if you don't want any metal in your mouth. I mean, who really wants silver fillings these days anyway, right? Amalgams, or everybody gets just regular white colored filling materials. So I think the trend is going that way, where maybe in the future, all implants will be made with zirconia and we'll get away from the titanium route. And the technology of the zirconia implant system just within the last 10 years have significantly improved. So I think the future horizon is very exciting for the zirconia implant industry. Is going to really boom over the next 10 to 20 years.
And you'll probably be busy with replacements.
Yes.
Are people coming in to swap out?
Some patients are that especially that have had issues during the first 5 years with the titanium implants, we will replace them. Now there are some patients that do come into my office, there is no problem at all, but they're just kind of afraid of something and they want it removed and replaced. And so I've taken some patients on replacing them, but many of them I have not, just because I felt that to try to restore them back with the zirconia implants exactly how they came in is going to be very difficult. So, kind of case by case basis, I've not taken everybody on for what they wanted, but on some of them I have replaced them with zirconia implants.
That's interesting. Good to know. I do have a question about, so in the birth world, we talk about informed consent. It's kind of a big thing. It's a big phrase that there's a lot of providers who don't explain what's going on. They don't really present the options. They don't really give you an opportunity. They present information like, hey, I'm the doctor. I'm in the white coat. Here's what you're going to do. And so you have a lot of women who may not understand that they have options. And so what I noticed is that when I was in your office, I really appreciated that it felt very like informed consent of what we talk about in the birth world, but in the dentist world, where it's, hey, look, you could choose whatever you like. Here's the options. This is a little bit more conventional. Here's the amoxicillin. It's not required. You don't have to do it. Choose what you want to do. And then, we can go at I shouldn't say as conventional as you like, but really, here's some of the more conventional options depending on where you are. And here's some of the more holistic options. And you really pick your path. It's like those old children's books where you're kind of choosing your own adventure. And I really appreciated that approach, especially coming from, I take a little conventional on the side of my holistic.
Mhm.
So I did take the amoxicillin and I was fine.
Yes.
I took something on the way to calm my nerves because I was really nervous. And no matter
Yeah.
how much energy healing I was doing on myself, my nerves were shot because dental stuff is not a walk in the park for me. So would you say that generally that's the way that you choose to run the business is here's a range of choices?
Yeah, absolutely. I think that it's very important that we provide informed consent. Every patient needs to know that there are options. It's not just my way or my recommendation. Although many times I will give the choices, give the options, the available options to the patients, and many times the patients will say, "Doc, if I was your wife, or what would you do, what would you rather have me do?" And so many times they leave it up to me, but it is important that they know that there are choices, that yes, we don't have to only use human bone. Okay, because talk about bone grafts, and nobody explains to you that when you have a tooth taken out, that there are different types of bone available to us. Okay, so many times they just say you're getting a bone graft, and you would just assume that it's a human bone graft, but there are animal bone like cow bone, horse bone, that could be also used, and there are synthetic bone. Okay, and so the human bone has been around forever. And again, the holistic community will frown upon the human bone just due to there's been some, I would say, bad companies that have produced maybe illegally, or they didn't, the sources of the cadaver bone were not proper. And so there's been some issues historically of the misuse of human bone products. But again, yeah, I've used it for many years, and I stick with a very reputable company for human bone, and I've not had any issues with it. But I know where the holistic community, what they are afraid of, which is, there's been some companies in the past that have done some funny business, so
Mhm.
but the holistic community do like synthetic bone that's available to us, because then they can trust the lab. They can, it's not coming from an animal or a human, and that has worked really well. It complements the zirconia implants really well. It's just hydroxyapatite. Your body's full of hydroxyapatite, so it's not rejecting it or anything like that.
Mm.
In certain cases, yeah, we do have to use a little human bone. We do have to use animal bone in certain areas. It just tends to work better. But in many cases, I tend to use synthetic bone for a lot of these patients because they muscle test very well with synthetic bone.
Mm. I think
For
I had a
most,
combo.
yeah,
I
yeah,
had a combo of synthetic and
yeah, yeah,
animal. Oh, and
human and animal bone. I mean, we use a combination of a lot of those bone graft materials, especially in the sinuses. I like to use animal bone. So, yeah,
And
it
I will
sticks
say
around.
the concept creeped me out at first.
Yeah.
But that's why I worked on the material. I tuned
Mhm.
in energetically and cleared anything that was related to any animal, any old human being who, it was taken from, and clearing the material and then asking my body to make friends with the material so that the procedures were well
Mhm.
received, that my body received the healing and accepted all of the materials, the synthetic, the cadaver, the implant too, which I was a little
Mhm.
worried about, but so far so good. And I'm feeling
Yeah.
like it's going really well. The next thing I'm looking at is, obviously my gum recession. So I've started to explore. And one thing I haven't had a chance to ask you is, do you do any kind of light therapy on gum recession?
Light therapy is very interesting. I don't do that currently at the office, but you're talking about like maybe red light, blue light. Are you familiar with the beamer mats? Yeah, I have Beamer mats, which we will have it at the office when the new office location opens in 2027. So we'll have like a little place where we have the mats after healing, and we'll have light therapy that patients will use on their face. So they'll lay on the mats. It will help with the healing process. It's basically increasing microcirculation. I do use that personally at home, and I liked it so much that I will be incorporating it for my patients in the office as well. It's just that my office space right now is very small, and I just don't have room for things like that. But we are renovating a new office space in St. Pete. It's about 10 minutes away from my current office, and we are due to open that space in 2027 sometime. So
Mm.
we'll have a little lounge where patients could recoup after surgery or in between cleanings or whatever it may be. I'm not sure how it's going to play
Oh,
out,
that would be
but
awesome.
yeah, light therapy is excellent. I tell patients if they have access to that or saunas and things like that at home,
Mhm.
definitely do it. It will help with the healing. It helps. I wouldn't say that in your situation, just because you do light therapy in your mouth, that you're going to regenerate gum where you won't
Mhm.
need to have any kind of grafting. I wouldn't say that, but
Mhm.
for healing purposes or to minimize infection or fast recovery, absolutely. You tear like a muscle soreness area, or you had surgery in your face and you apply red light therapy to that area, it's going to significantly help the healing time for sure.
Mhm. Okay,
Yeah,
that's
so I do
interesting. I didn't
recommend
even
it.
realize you guys are getting a new office. And just so everybody knows, I crossed the bridge to go to your office because
Yeah.
I could not find anybody in my
Mhm.
part of town. And based on what I've heard from my community and people who live outside of Florida, who live out, people travel for this kind of thing. They will travel
Yeah.
for the correct people, if there's not an aligned provider in their area. I've actually
Yeah.
been talking to some friends who live in another part of the country and they're looking at places. And I said, just come stay with me for a couple days.
Yeah.
You go,
Yeah.
because I go across the bridge. I travel about 45 minutes each way
Mhm.
to go to the office, and it's fine. When I have
Yeah.
friends tell me, they're like, "Why are you spending the whole morning at the dentist?" And I said,
Yeah.
"Listen,
Yeah.
at 42, something that I can say is that my mouth is so important, and I wish I knew then
Mhm.
what I know now. And I even now, I get much more frequent cleanings, even and checking what's going on because I don't want further issues. I want to, stay on top of it. I can't
Right.
allow it. And I will tell you something that came to mind when we were talking about root canals and the nutrient depletion during pregnancy. Other than childhood, the only other root canal I ever had was right after my first child was born.
Mhm.
So he was born in 2013. I had a C-section. I took prenatal vitamins, but back then, I don't know. I was probably taking some basic, I don't even know. I was not very into supplementation.
Yeah.
It's only a couple days old, and I stopped taking the heavy pain management drugs after the C-section. Immediately, I had excruciating pain in my mouth, and it was almost like my body was waiting to tell
Mhm.
me until pregnancy was over, like, "Hey, you've been depleted." And I had to go have a root canal when he was a couple days old, and it was
Wow.
awful. It was
Yeah.
awful. 0 out of 10, do not
Mhm.
recommend.
Yeah.
Um, okay, so
Mhm.
bringing it back,
Mhm.
so I say all that to say, for anybody who's not local to Tampa, St. Pete, this general Tampa, St. Pete, Clearwater area, I still feel like, especially in St. Pete. So you and the
Mhm.
other dentists who I've been working with, because there are certain parts that they do that you don't do. You guys did most of the heavy lifting, the big
Yeah.
surgeries, and I think they did
The
the
crown.
they
The
did the crown.
crown. Yeah.
And
That
I had
goes
some
right on top.
restorative, like I did some restorative work there as well, but I felt like more of the holistic dentist
Mhm.
options were across the bridge, so in St. Pete.
Right. Yeah.
And I'm going to link to your website as well so that people can bombard you with.
Yes, wonderful, wonderful. And I work with a lot of physicians together. And some of the physicians I don't really waste time just because the traditional physicians they just don't understand or they just don't get it. But in St. Pete, I found one that is amazing. So if you ever need it, he is an MD. He is very in tune with a lot of the endocrinology side, so all the hormonal issues or thyroid issues. He's very functional medicine, holistically minded, excellent physician that I've worked many of my patients with. So we tend to refer to Dr. Chan a lot. He's right across the bridge, right near me as well.
I was going to say, you're welcome to name drop if you like, because that's something that I haven't found is, a provider for myself that is.
Yeah. He's in St. Pete, Colin Chan. Chan is the last name. I actually see him, personally, and I got to know him through patients.
Mm.
And I found him fascinating because he just knew so much more than the traditional MD. He just knows a lot about the holistic side. He knew hormonal side, the thyroid issues, and the bone density issues that a lot of my patients had. So we need to have a team. I think having a naturopath is excellent as well, but having a physician, having a dentist that understands this whole thing and putting it all together. And so I'm the other side. I mean, usually there's a two dentist team. I am one of the two dentists. There's the restorative dentist and there's the surgical dentist as well. So I tend to play a part in that role. But it's not just myself that I can provide things for our patients, but I like to work in as a team if necessary. I mean, if they're not having any other health issues, if they're fine, then yes, we can handle it just on the dental side. But if patients are having a lot of other health concerns or issues, we do need to work together with the physician just to make sure that like some of the medications or supplements that we're going to recommend have no contraindications to what they're trying to achieve.
Well,
Yeah.
and really that none of this stuff is happening in a vacuum. So I can
Mhm.
appreciate taking a wider perspective, not just zeroing in on the one tooth issue, but what's the bigger picture, what's happening um, at the root, what's happening at the root, really. Like
Right.
it's funny play on words, but what's happening underneath, instead of band-aiding. So
Mhm.
I appreciate that as well. And I want to respect your time because
Yeah.
I know you committed to a certain amount of time.
Yeah.
And I also just appreciate your time. I will see you guys pretty soon to get my mouth guard. And then I
Yeah.
never want to see you again. No, I'm kidding. Back,
Yeah.
because you have a
Yeah.
lovely dental hygienist that's very
Yeah.
careful with me. She's very gentle with me. She's so patient. And I
Yeah.
appreciate that because I'm a big baby. When I can push out 9-pound humans,
Yeah.
fine. But when people are messing in my mouth, it's not my favorite thing, but she makes it your whole team really makes it. I will say like the special touch, like the blanket during the surgery and this little eye mask
Yeah.
was like chef's kiss.
Yes. Well, thank you so much. And because there's a lot of moms listening, I think the one thing that everybody should get away from this podcast is this. If you are thinking about getting pregnant or if you are pregnant, please see a periodontist. If you're local to the area, come see me in St. Pete. But see a periodontist because you need a good periodontal exam. It's not just a dental exam. You need a gum examination just to make sure that there are no bacterial infections that you might have in your mouth that could transfer to the baby, which could lead to all sorts of other complications. So it is very important for moms or expectant mothers to have a periodontal examination.
Yeah.
Yeah.
Well, and then, as the kids get older and you start taking them to the dentist. So now I'm tuning
Mhm.
into like at what age do we start taking our kids to have a gum exam? Because I don't know that my kids have had a proper gum exam by a periodontist.
Yeah. Yeah. Bring them. I'll be more than happy to see them.
I don't know. You
Yeah.
might you might change your mind once they get in the office. I'll take
Yeah.
one at a time so it
All right.
doesn't drive the office crazy.
Yeah.
Okay, well, thank you so
Thank
much.
you, Nichole. Thank you.
All
It was
right.
fun. Let's do it again.
Okay, that sounds good.
Thank
I'll
you.
see you soon. Have a great weekend.
Thank you. You too. Bye-bye.
Bye. Okay, so what'd you think? Since words of affirmation are my love language, no, I'm just kidding. I don't really do love languages because I like all of them. But the truth is that recognition and feeling seen and heard lights me all the way up. I'm a projector. If you don't know about human design, now you know a little something. 20% of the population are projectors, and we light all the way up when we feel seen, recognized, heard, And so by you giving me feedback, whether that's a rating, a review, a subscribe, sending me a note, letting me know if this episode resonated, it actually lights me up and it gives me more energy and juice to keep going and bring you more. Plus, I'm forever grateful to hear your feedback for how my work is helping you. So, do all the things, subscribe, rate, review, and I can't wait to hear from you.